Adverse drug effect. Adverse drug effect is any undesirable or unintended consequence of drug administration, establishing a direct causal link between the drug and the reaction, where common reactions, these often involve the central nervous system, skin, or gastrointestinal system. Serious reactions, defined by the FDA as those causing death, life-threatening scenarios, permanent disability, or requiring hospitalization. It is classified as 1. Predictable, or Type A. They are largely predictable on the basis of the known pharmacological actions of a drug and usually are dose-related. Qualitatively, they respond to the drug, including side effects, toxic effects, and consequence of drug withdrawal, such as bleeding from aspirin. Unpredictable, or Type B, these are based on peculiarities of the patient and not on drugs' known action, include allergy and idiosyncrasy. They are less common, often non-dose related, generally more serious, and require withdrawal of the drug. They are also known as bizarre and qualitatively ADR, such as rashes or organ damage, which are not related to dose. Severity of the adverse drug reaction has been graded as 1. Minor, no therapy, antidote, or prolongation of hospitalization is required. 2. Moderate, requires change in drug therapy, specific treatment, or prolongs hospital stay by at least 1 day. 3. Severe, potentially life-threatening, causes permanent damage, or requires intensive medical treatment. 4. Lethal, directly or indirectly contributes to death of the patient. Adverse drug effect may be categorized into 1. Side effect, 2. Secondary effect, 3. Toxic effect, 4. Intolerance, 5. Idiosyncrasy, 6. Drug allergy, 7. Photosensitivity, 8. Drug dependence, 9. Drug withdrawal reaction, 10. Teratogenicity. Prevention of adverse effect to drugs. 1. Avoid all inappropriate use of drugs in the context of patient's clinical condition. 2. Use appropriate dose, route, and frequency of drug administered based on the patient's. 3. Adopt correct drug administration technique, example, IV injection of vancomycin must be slow. 4. Carry out appropriate laboratory monitoring, example, prothrombin time with warfarin, serum drug levels with lithium. 5. Rule out possibility of drug administration technique when one or more than one drug is prescribed.